We're going to get started this morning with the latest in the fight against the coronavirus. The Omicron variant has now been detected in all 50 states just 3 weeks after the first case of the new strain was discovered in the U.S. Several states are now reporting more COVID cases than at any other time during the pandemic. Hospitalizations are also on the rise as states from New Hampshire to Ohio deal with a record number of patients inside their hospitals. Now, it appears help could be on the way to stem the tide of serious illness. The FDA authorized Pfizer's COVID antiviral pill yesterday, making it the first at-home treatment to protect Americans from severe cases of COVID. NBC News medical reporter Erica Edwards joins us now. Erica, good morning to you. Let's start off with that FDA authorization for Pfizer's COVID antiviral pill. What impact will this have on the COVID battle, and how long do you think it'll take until the pill can actually be distributed around the country?
Sure. Hey, Joe, good morning. So right now, that pill, Paxlovid as it's called, from Pfizer is in relatively short supply. It's really complicated to manufacture this pill. It takes 6 to 8 months on average. By January, we do expect to see about 265,000 courses of treatment, and as many as 10 million courses of treatment by the end of summer. But Joe, that's 8 to 9 months from now. Right now we are averaging nearly 150,000 new cases of COVID-19 every single day.
Yeah, right now we can't rely on that for quite a few months, it sounds like. Erica, with Omicron now in all 50 states, we know hospitalizations are also rising across the country. Where are we seeing the biggest increases right now as we head into the Christmas weekend?
Right. Hospitalizations have been rising in areas with lower vaccination rates, generally in the Midwest, Pennsylvania, Ohio, Michigan, Indiana, but also in places with higher vaccine uptake in the Northeast, for example, Connecticut, New York, New Jersey, New Hampshire. Now, overall hospitalizations have risen 39% since November 1st. Now, there is a little bit of promising news. Just yesterday, there were 3 studies that came out from the UK and South Africa suggesting that hospitalization rates related to the Omicron variant are significantly lower when compared to Delta. We'll still have to wait to see how it plays out here in the U.S., Joe.
I want to ask you about something on a lot of minds today, and that's travel. A new report from Bloomberg, quoting a top medical advisor to the world's airlines, says we should assume flyers are now 2 or 3 times more likely to catch the virus during a flight since the emergence of the Omicron variant. Now, keep in mind, flying has been seen as sort of a safe way to travel for some time now. What does this mean for Americans who are preparing to fly out today or over the next few days for the holidays?
Yeah, that headline sounds a little dire. That advisor was basically saying that because Omicron spread so much more easily than Delta, it just makes sense that your risk is higher, really, no matter where you are. But in general, just as you said, Joe, air travel is considered safe. There's pretty good airflow. Generally, people are masked, not interacting unless you have a particularly chatty seatmate. But that said, in general, experts say the old advice still stands. Keep up with your hand washing, avoid high touch areas. And generally, you might want to stagger the times that you and your seatmate have your masks off for eating and drinking. That should keep you as safe as possible while you're traveling this weekend.
That's good advice there. Those precautions, incredibly important, not just on the plane, but also when you're walking through the airport as well. Erica Edwards, thanks so much. Now, that heightened risk of getting on a plane is one of the reasons many travelers are actually taking to the roads this holiday season. More than 100 million Americans are expected to travel to visit family this week, and many are opting for a safer and more flexible way to get to their loved ones. AAA predicts an increase in car travel. The number of people flying or taking a train is expected to drop. But whether you choose plane, train, or automobile, travel will likely cost you more this year. NBC News reporter Gary Grumbach joins us now from Newark, Delaware, with more on this. Gary, thanks for joining us. So why are cars looking like the preferred travel method this year? And what are some of the concerns you're hearing as more travelers hit the road?
Hey there, Joe. Good morning. Yeah, especially with Omicron sweeping the nation, we're seeing and we're hearing from doctors, if you're in a crowded public place, there's a really good chance somebody there has coronavirus and they may not even know it yet. And of course, during this holiday season, there are a lot of those crowded public places, and cars are just safer in that respect, especially as you're traveling long distances. Here's what the AAA spokesman I spoke to this week had to say.
Because with a car, you have a lot more flexibility. You can decide when you want to leave, where you want to stop, who's in the car with you. So people may feel a little more comfortable this year just by, hopping in the car and going away.
Now, before you get in the car, experts say to check some really basic things. First, if it's the first time you've been on a long road trip, make sure your Easy Pass is all up to date. The last thing everyone wants is a violation ticket a few weeks after a fun family gathering. The other thing that will save you money and also just keep your car safe is by making sure you have enough air in your tires. The gas prices right now are down, but if you have air in your tire, not enough air in your tires, it is going to cost you more to go on these road trips. Joe?
The downside of road travel might take a bit longer, but hey, more bonding time with your family. Now, we mentioned those rising costs. Why is travel so much more expensive this season? And for those still looking to rent a car or try and book a last-minute ticket, how much should they expect to spend?
Yeah, unfortunately, no matter how you do this, it's going to cost you. Car rentals are up more than 20% this year. The good news is, at least these car rental companies have cars to give you. You'll remember during the middle of the pandemic, a lot of these companies sold half their fleets just to keep their own businesses afloat. It seems that's really sort of normaled out, and car companies are back to a normal inventory level, but that is about a 20% higher cost than usual. Hotels are up 36%. But a tip for you, Joe, all year you collect these points, these reward points at hotels from your work travels. Use them this time of year. That's what they're here for. Now, remember, they won't cover all of your expenses because taxes and fees don't count with these points, but that's certainly a good tip to start for you there.
All right. I know my bank of points is a little lower this year. Didn't travel as much, but some folks did. Now, Gary, many thought this holiday season would be a return to normal. Sadly, that's not the case. If you're traveling, how do you keep yourself safe and how do you keep your loved ones safe from the Omicron variant?
Yeah, Joe, I got to tell you, yesterday I was covering a bunch of different COVID testing centers, and the lines, there was just so much frustration that we're still going through this. But experts say, AAA, doctors, they all say, remember the basics, remember what we've learned throughout the past 2.5 years of this pandemic. Here's what AAA spokesperson had to say.
Where you are, maybe the pandemic's not raging quite as fiercely right now, but where you're going, it could be. Have extra masks with you. Limit your exposure. Try and avoid crowded indoor situations. All those type of things.
Bottom line, Joe, people are excited to get out. 110 million people this week are going to be doing just that. They just want to be doing it safely. Joe?
That's the priority. All right, Gary, thank you so much. Now, for many Americans who want to get tested for COVID before hitting the road, it has been tough. They've had to deal with long lines and wait times at testing sites. This week, the Biden administration outlined a plan to boost the nation's testing infrastructure. But will it be enough to help keep Americans safe ahead of the holidays? NBC News correspondent Jake Ward has more.
Good morning, Joe. The White House is stepping up efforts to create a nearly ubiquitous testing regimen here in the United States, announcing that they will create federal facilities at sites all across the country. They're beginning with New York City in order to backstop the state capabilities when it comes to the labs that they need to process testing. They're also talking about making at-home testing more or less free, buying up about 500 million tests individually and then making them available on a website to anyone who wants them. It really mimics something we've seen abroad, in which governments are essentially buying these at-home tests and then providing them free to their citizens. Why do we need all of this? Well, it's because, according to a Harvard roadmap to pandemic resilience, we're going to need to be testing about 20 million people a day in order to really remobilize the economy and keep everybody safe. At the moment, we're really only testing about 1.5 million people a day, and even at the peak of testing back in December of 2020 and into January of 2021, at that point we were only doing about 2.2 million a day. So we really need to get up to that number. We've been speaking to private companies. There's about 11 of them that make the individual at-home tests, and they say they are ramping up capabilities, that if anything, in many cases they saw the projections internally in their own data and knew they had to get out in front of this and begin to ramp up testing and their capabilities. But it is clear that those will not be adequate inadequate to actually bring us up to 1/6 of the population every day. That's about 20 million people. Because if we're going to continue to see these variants popping up, even in vaccinated people, we're going to need tests before we go get together with our coworkers, get together with our families, or enjoy holidays like we're just about to. Joe?
Jake Ward, thanks so much. Now, that push to increase the country's testing capabilities comes as COVID cases surge around the U.S. Let's bring in Dr. Bob Lahita now to get his insights. He's a professor at the Hackensack Meridian School of Medicine and director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Bob, always good to have you with us. So where is the country at right now in terms of COVID testing? Do you think the government's doing enough to expand testing capabilities around the country?
I think the government is doing enough, Joe. They're sending 500 million cases of the rapid testing kits out. I don't know how the public is going to access them. That's one question that's big, maybe through pharmacies, maybe through mail order. Roughly 19 tests have been done per 1,000 people. That's the PCR test. Of course, we have no way of measuring who does the home testing, but lots of people are lining up in droves. Cars, sometimes 3 apart at our hospital, blocking traffic. It is a little bit of a chaotic situation, Joe.
Doctor, we did get some welcome news we talked about at the top of the show with Pfizer's COVID antiviral pill. What role will this treatment play in trying to keep patients out of the hospital?
Well, this is a game changer of sorts. The drug is called Paxlovid. It's really a protease inhibitor. This is the kind of thing, to make people understand what it is, has been used in HIV and it has been used in hepatitis C treatment. It's basically a 5-day regimen, and it involves another drug called ritonavir, which everybody, all physicians and certainly many nurses know. It's extremely effective. If you have symptoms, you must take this pill for within 5 days of having your symptoms in order to prevent you from getting into the hospital. It's much like Tamiflu, but far more powerful. And so this pill is a game changer because hopefully it'll keep people out of the hospital, out of the ICU, and prevent them from dying.
Dr. Lahita, I wanted to get your take on Israel's plan now to roll out a 4th dose of the COVID vaccine to citizens who are over the age of 60. Do you think this is something the U.S. should consider or will soon consider to help protect Americans who are at risk of severe COVID symptoms?
Well, Israel is trying to give the shot, the 4th shot, to people over the age of 60, 4 months after the 3rd shot. Now, people are weary of getting boosters. You know, in the United States, only 30% of the people who have had the 2nd shots get the 3rd booster shot. So I'm not sure how good this is going to be. And of course, we're listening to the Pfizer and Moderna people who are saying because of the molecular nature of the vaccine, messenger RNA, they're able to tweak within 3 months to produce a new, very specific, Omicron specific, for example, vaccine, which can be given to people. But I'm not sure that people are going to line up in the U.S. for a 4th shot. Israel is somewhat of a bit more hermetically sealed country right now. And I suppose it is possible that the Israelis will take a 4th shot over the age of 60. Certainly a good idea, particularly if you're immunosuppressed or have a problem with your immune system overall.
Dr. Bob, tomorrow and Saturday, a lot of families across the country are going to be getting together. For those who are a little anxious about those gatherings, what's the advice you have about how to do it safely?
Well, our family is making sure that everyone is tested before they come to the Christmas dinner. Everyone is vaccinated and has had their booster shots, and that's the first level that you have to consider. People should be vaccinated before they get together, and even if they are vaccinated, they should wear masks until it's time to drink or eat within certain parties and certainly within family gatherings. And again, it doesn't hurt to get a home test and test yourself prior to going to dinner, within 24 hours of going to your dinner or your party. That's what. And make sure there's ventilation and wear your mask of all things and wash your hands.
Speaking of your family, Dr. Bob, I had the privilege of meeting your wife, Carolyn, who is a fantastic sculptor. We did a story on her that aired on the Today Show and yesterday here on News Now. Incredible to meet her, and we're so grateful we had the chance to tell her story.
She is so proud, Joe, and we are so proud of her. She's an amazing person, and thank you for bringing her up. She'll love it.
Sounds good. Wishing you and your family a great holiday weekend. Dr. Bob, as always, thanks so much.
And to you also, Joe.
This morning, five suspects are in police custody in Delaware after a U.S. congresswoman was carjacked in broad daylight. Representative Mary Gay Scanlon was robbed at gunpoint in her Philadelphia district yesterday after attending a meeting in that city's FDR Park. Police said the suspects were later found that evening in Scanlon's car about 30 miles from the scene of the crime. Scanlon was not injured in the attack. And in a seemingly unrelated incident, an Illinois state senator, Kimberly Lightford, was also carjacked while in a Chicago suburb with her husband on Tuesday. Police say multiple shots were fired, but the couple was unharmed. Authorities are still searching for the suspects in that case. The investigation into the Capitol insurrection is once again shining a spotlight on members of Congress. Now the January 6th committee is calling on Republican Congressman Jim Jordan to provide information. Jordan is a Trump ally. He's now the second member of Congress to be called forward after Pennsylvania Representative Scott Perry was asked to cooperate on Monday. NBC News senior congressional correspondent Garrett Haake joins us now. So Garrett, why is the committee asking Jordan for information right now?
Well, Jordan is as close of an ally to Donald Trump as they come in Congress. And so the committee wants to know about really all of his communications with the then president between Election Day and Insurrection Day. But they really want to know about the conversations he was having with the president while the attack on the Capitol was on. Jordan has said several times that he spoke to the then president several times on that day, but he's yet to reveal the contents of that conversation. Even after the riot was over, he was still someone who was voting to throw out some of the election results. So those conversations in the context of those 5 or 6 hours, especially in the afternoon when the attack was at its peak, that's at the heart of the committee's inquiry here.
Garrett, what is Jordan saying about all this? Any signs he'll cooperate, or is that highly unlikely at this point?
It was interesting, Joe. He was asked about this on Fox News last night and didn't seem to slam the door. We can parse this response on the other side. Listen.
I mean, we just got the letter today, Brian. We're going to review the letter, but I got to be honest with you. I got real concerns about any committee that will take a document and alter it and present it to the American people, completely mislead the American people like they did last week. And it turns out it looks like it wasn't just one document they did this with. It was other text messages as well. So I got real concerns with that.
So Jordan's talking about a copy edit there made to shorten one of the text messages that was displayed during the debate around Mark Meadows' contempt charges. But the thing he's got working against him is Jordan has said several times in public that he's got nothing to hide should the committee ever come calling. And Joe, now they're calling.
Yeah, they are. And Garrett, Jordan is the second sitting member of Congress to be called for questioning by the committee. Help us understand how significant and perhaps unprecedented is this moment for American politics, and could we still see more members of Congress called forward?
Yeah, this just isn't done to have members called, or at least to have members forced. And I think that's where this could get weird, Joe. You know, it's one thing to ask a member to testify on a subject in which they might be an expert. In this case, you could argue that Jim Jordan is as an expert as they get in Congress on the insurrection. But if we get into the realm of subpoenas or punishment for not showing up, then we are deep down the rabbit hole. And this is the kind of thing where we don't know how this Congress will handle it, and we don't know how the next Congress will handle it. I think that's one of the concerns for the Democratic members of this committee in particular. Should control of Congress switch next year? Are we setting a precedent here where any member can be called or subpoenaed by the other party and forced to testify about you know what? Joe, I think the person who's watching this debate most closely might be Kevin McCarthy, the minority leader right now, someone who we know the committee wants to talk to. Trying to force him to testify before this committee would be a huge departure from the kind of norms of Congress, and it'll be fascinating to see how it all plays out.
We're going to see in the new year, probably. Garrett Haake, thanks so much. Appreciate it. Time to get a check on your morning news now weather. Michelle Grossman with us again this morning. Michelle, good morning.
Good morning, Joe. And many of us are going to be digging out in the West, while some of us are going to be sweating in summer-like weather. So let's take a look at the big story, because that's the western storms. We're looking at big-time snow. We're looking at heavy rain. You can see that floating inland, and that's been happening day after day throughout this entire month. And it's going to happen at least through the next week. So as we look towards the Pacific Northwest down to Southern California, we are looking at wet weather. Higher elevation snow, we're looking at 8 feet in some spots through Sunday. So winter weather advisories, winter weather watches, winter weather warnings are in place from the Pacific Northwest through California to the Rockies, and we're going to be digging through the snow over the next couple of days. So this is the setup today. We're going to see that big rain and big snow, rain spreading down to Southern California. We could even see some flash flooding in Los Angeles, even San Diego, especially in those burn areas. And then we're going to be accumulating feet of snow in the Sierra Mountains. That will move further inland on tomorrow, where we're going to see it move into the Rockies. And then another Pacific storm hits the West Coast. So again, it's that December deluge where we're seeing storm after storm, and we're really seeing those rain totals and snow totals adding up. So the rainfall forecast through Saturday, you can see lots of dark colors on this map, up to 5 inches in some spots. That's half a foot of rain in some spots. Los Angeles, you're going to get a lot of rain too. And that includes Christmas Day, also Christmas Eve, Redding, Portland, San Francisco, even San Diego having some of that heavy rain. And then the snowfall forecast, generally 2 to 3 feet of snow, but some spots in the highest elevation, the Sierras, would be digging out of 8 to even up to 10 feet of snow. I know it is crazy. Now, on the flip side, some of us are going to be barbecuing on Christmas Day. We're looking at temperatures so above normal, even some temperatures feeling closer to July 4th as opposed to Christmas Day. So Oklahoma City, 80 degrees today, 80 degrees on Christmas, Dallas, 81, Houston, 81, and even in the upper 60s to near 70, 71 degrees on Christmas in Memphis. And that warmth starts today. You can see lots of dark colors on this map that's indicating that warm air in place, that high pressure dome of high pressure just spinning in this warm air. So 77 degrees today in Lubbock, that's 26 degrees above normal, 64 in Oklahoma City, and 73 in Dallas. By tomorrow, we're looking at temperatures close to 80 in many spots, even 80 in Lubbock, 79 in Austin. The record is 82 there. A lot of records are going to be broken over the next several days. We're talking about hundreds of millions above normal for this time of year. And then as we look towards Christmas Day, yeah, that heat stays in place for many. So, Joe, it's going to be 70 degrees in Louisville on Saturday. And certainly I think a lot of people are hoping on that Christmas list, wishing for some shorts.
Yeah, no kidding. Who would have thought? You know, a little something for everyone across the map this holiday. All right. Thanks so much, Michelle. Appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.